Good morning. Hope you're doing well today. Today we are talking about Chapter 19, Clients with Nutritional and Metabolic Concerns, and really going more into diabetes and eating disorders. This is Part 4. Mellitus, commonly referred to as diabetes, is a chronic metabolic disorder characterized by elevated blood glucose levels or hyperglycemia. It occurs when the body either does not produce enough insulin or cannot effectively use the insulin it produces. Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels and allows cells to take in and use glucose for energy. There are several types of diabetes mellitus, including type 1. This type of diabetes occurs when the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, the body produces little to no insulin. Type 1 diabetes usually develops in childhood or adolescence and requires lifelong insulin therapy. Type 2 diabetes is the most common type of diabetes, accounting for the majority of cases. In type 2 diabetes, the body either does not produce enough insulin or becomes resistant to the insulin it produces. It is often associated with lifestyle factors such as obesity, sedentary lifestyle, and poor diet. Type 2 diabetes can often be managed with lifestyle modifications, oral medications, and in some cases, insulin therapy. Gestational diabetes is a type of diabetes developed during pregnancy and usually resolves after childbirth. However, women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. When designing an exercise program for clients with diabetes mellitus, it's important to consider their individual needs, medical history, and current fitness level. Here are some key points to consider when prescribing exercise for individuals with diabetes. First, clients with diabetes should consult with their healthcare provider and before starting an exercise program, especially if they've had any complications or other underlying health conditions. Regular monitoring of blood glucose levels before, during, and after exercise is important, especially for those with type 1 diabetes, to assess the impact of exercise on blood sugar control. Aerobic exercises such as walking, cycling, swimming, or aerobic dance can help improve cardiovascular health, insulin sensitivity, and blood sugar control. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, spread over several sessions. So a frequency of 3 to 7 days per week for 20 to 60 minutes per day is really what is recommended. And ideally, it should be moderate to very hard as far as intensity is concerned. Again, you want to monitor blood glucose levels during aerobic exercise and have fast-acting carbohydrates available in case of hypoglycemia. Resistance training exercises help improve muscle strength, increase lean muscle mass, and enhance insulin sensitivity, including exercises targeting major muscle groups such as squats, lunges, chest presses, rows, and shoulder presses. Perform resistance training 2 to 3 times per week, allowing for adequate recovery between sessions. So 2 to 3 days per week, at least one set of 8 to 10 different exercises using major muscle groups, and about 10 to 15 reps per set with the amount of weight increased and a number of repetitions reduced only after the target number of repetitions per set can consistently be exceeded. While exercising is generally beneficial for individuals with diabetes, there are certain situations or conditions in which exercise may be contraindicated or require caution. It's important to consult with a healthcare professional before starting or modifying an exercise program if any of the following contraindications or precautions apply. Uncontrolled blood glucose levels. Exercise may be contraindicated if blood glucose levels are consistently too high. And typically we call that greater than 250 milligrams per deciliter, and if there are ketones in the urine for type 1 diabetes, or too low in the case of hypoglycemia. Blood glucose levels should be well managed and within a safe range before engaging in exercise. Individuals with severe diabetic retinopathy. It's a complication affecting the blood vessels in the retina. They may need to avoid high-intensity activities or exercises that increase intraocular pressure, such as with heavy resistance training, to prevent the worsening of eye conditions. Any open foot sores or active infections require proper medical condition and may restrict certain weight-bearing exercises or activities that could exacerbate the condition. It's important to prioritize wound healing and infection control before resuming exercise. Uncontrolled blood pressure. Individuals with uncontrolled high blood pressure may need medical management and blood pressure stabilization before engaging in vigorous exercise. High-intensity activities may further elevate blood pressure and pose risks. Individuals with significant cardiovascular complications, such as a recent heart attack, unstable angina, or severe heart failure, should receive clearance and guidance from their healthcare provider before initiating or modifying an exercise program. Exercise stress testing may be necessary to evaluate cardiovascular function and determine exercise capacity. DKA is diabetic ketoacidosis. It's a severe and potentially life-threatening complication of uncontrolled diabetes. In cases of active DKA or recently resolved DKA, exercise should be postponed until blood glucose and ketone levels are normalized and medical guidance is obtained. Certain morbidities or medical conditions such as kidney disease, peripheral neuropathy, or autonomic neuropathy may require modifications to exercise routines or specific precautions. These conditions may affect exercise tolerance, blood flow, or the body's ability to regulate temperature and hydration. Pregnant individuals with gestational diabetes or pre-exercise diabetes may need modified exercise programs and should consult with their healthcare provider to ensure the safety of both mother and the baby. It's essential for individuals with diabetes to have regular checkups with their healthcare provider to assess their overall health, manage their diabetes effectively, and determine the suitability and safety of exercise. Healthcare professionals can provide personalized advice and guidance based on the individual's specific medical history, current condition, and goals. It's important to consider each individual's unique needs and underlying medical conditions. First, flexibility training. You want to make sure that you include stretching exercises to improve flexibility and range of motion. Performing stretching exercises after the aerobic and resistance training components of your workout. Focus on static stretching and hold each stretch for 15 to 30 seconds. You want to consider the individual's fitness level, health status, and personal preferences when determining exercise intensity. Encourage a combination of moderate intensity and vigorous intensity exercise depending on the client's capabilities and any existing complications. Clients on insulin or certain diabetes medications may need to adjust their medication regimen to accommodate exercise and make sure that they are eating a balanced meal or snack before exercise and staying adequately hydrated to help maintain blood sugar levels during exercise. You also want to encourage them to wear appropriate footwear and clothing and to check their feet regularly for any signs of injury. Clients with diabetic neuropathy or other complications should take extra care to avoid injuries. Provide education on the signs and symptoms of hypoglycemia and appropriate actions to take if it occurs during exercise. Tailor the exercise program to their preferences, abilities, and any existing complications. And consider their schedule, access to facilities or equipment, and personal goals when designing the exercise program. It's crucial for individuals with diabetes to work closely, again, with their healthcare professionals and that they are regularly monitoring their blood glucose levels, especially with type 1 diabetes. Ongoing communication with the healthcare team and adherence to medical advice are key for successful diabetes management through exercise. What happened to the rest of that? Eating disorders are complex mental health conditions characterized by abnormal eating behaviors and distorted attitudes toward food, weight, and body image. They often involve a preoccupation with food, weight control, and body shape, which can significantly impact physical and psychological well-being. Disordered eating refers to a range of abnormal eating behaviors and attitudes toward food and body weight that may not meet the diagnostic criteria for a specific eating disorder, but can still have a significant impact on physical and psychological well-being. Here are some common symptoms and signs of disordered eating. Restrictive eating, frequent or strict dieting, avoiding certain food groups or limiting caloric intake below what is necessary for proper nutrition. Binge eating, consuming large amounts of food within a short period of time and feeling out of control during the episodes, and then experiencing guilt or shame afterwards. Compulsive exercising, engaging in excessive or compulsive exercise as a means to control weight, burn calories, or compensate for food consumed. Constantly thinking about food, calories, and body weight, with an excessive preoccupation with meal planning, food rules, and strict dietary regimens. Having a distorted perception of one's body shape or weight, often believing one is larger than they actually are, often called body dysmorphia. And using food as a coping mechanism for managing emotions such as stress, anxiety, sadness, or boredom. Withdrawing from social activities and avoiding gatherings involving food, or becoming increasingly preoccupied with eating behaviors to the detriment of social interactions. Feeling anxious or guilty or shamed before, during, or after eating, often accompanied by rituals or specific behaviors around mealtime. And regularly engaging in weight cycling, such as losing and regaining weight through restrictive dieting or other extreme measures. And experiencing fatigue, weakness, dizziness, irregular menstruation in females, digestive problems, or fluctuations in body temperature. It's important to note that experiencing one or more of these symptoms does not necessarily indicate the presence of a clinical eating disorder. However, if these behaviors persist, interfere with daily functioning, or negatively impact physical and mental health, it's advisable to seek professional help from healthcare providers, registered dietitians, or mental health professionals who specialize in eating disorders or disordered eating. Early intervention and appropriate support can help individuals establish a healthier relationship with food and body image. Disordered eating and restrictive eating are related but distinct concepts. Disordered eating refers to a range of abnormal eating behaviors and attitudes toward food and body weight that may not meet the diagnostic criteria for a specific eating disorder, but can have a significant impact on physical and psychological well-being. It encompasses a variety of unhealthy eating patterns and behaviors. Restrictive eating, on the other hand, is a specific type of disordered eating characterized by the limitation of food intake and the avoidance of certain foods or food groups. People who engage in restrictive eating often impose strict rules and guidelines on their eating habits, aiming to control their body weight, shape, or appearance. Here are some key points about disordered eating. Disordered eating includes a range of irregular eating patterns such as binge eating, purging behaviors, excessive dieting, and preoccupation with body weight and shape. It can be driven by a variety of factors, including societal pressures, low self-esteem, body dissatisfaction, emotional distress, and perfectionism. Disordered eating behaviors can occur on a continuum, ranging from mild and occasional to more severe and frequent patterns. While disordered eating may not meet the diagnostic criteria for a specific eating disorder, it can still have significant physical and psychological consequences and should be taken seriously. Restrictive eating involves intentionally limiting food intake, often by restricting calorie intake or avoiding specific foods or food groups. It's commonly motivated by a desire to lose weight, achieve a certain body shape, or maintain strict dietary control. Restrictive eating can lead to an inadequate nutrient intake, nutritional deficiencies, disruptions in metabolism, and negative impacts on physical and mental well-being. People who engage in restrictive eating may experience intense food cravings, obsessive thoughts about food, and a preoccupation with food and body weight. Restrictive eating can also contribute to the development of eating disorders such as anorexia nervosa or orthorexia nervosa. It's important to note that both disordered and restrictive eating can have adverse effects on physical health, mental well-being, and overall quality of life. It is advisable for clients to seek professional help from healthcare providers, registered dietitians, or mental health professionals specializing in eating disorders. They can provide support, guidance, and interventions to address those concerns and promote healthier relationships with food and body image. People with anorexia nervosa have an intense fear of gaining weight and a distorted body image. They often restrict their food intake, leading to severe weight loss, nutritional deficiencies, and potentially life-threatening complications. Anorexia nervosa is a serious eating disorder characterized by an intense fear of gaining weight and a distorted body image. People with anorexia nervosa often engage in extreme behaviors to restrict their food intake, leading to severe weight loss and potential health complications. Here are some common signs and symptoms of anorexia nervosa. Significant weight loss, rapid and extreme weight loss, often to the point of being underweight or having a body weight significantly below what is considered healthy for their age, height, and body type. Distorted perception of one's body shape or size, believing that they are overweight even when they are significantly underweight. Excessive preoccupation with body weight, shape, and appearance. An overwhelming of gaining weight or becoming fat despite being underweight. This fear may persist even as weight loss continues and is alleviated by reassurance from others. Imposing strict dietary restrictions such as severely limiting caloric intake, avoiding specific food groups or types of food, and adhering to rigid mealtime rituals or schedules. Constantly thinking about food and calculating calories and meticulously tracking food intake may develop an obsession with nutrition labels, portion sizes, and caloric control, and often engaging in ritualistic behaviors around food, such as cutting food into tiny pieces, arranging food meticulously, or eating in a specific order. They may develop elaborate excuses to avoid eating or eating in social situations, and engaging in compulsive or excessive exercise as a means to burn calories and compensate for eating or control weight. Exercise is often driven by anxiety and an intense desire to lose more weight. Withdrawing from social activities and avoiding meals with others, becoming increasingly isolated to hide eating behaviors and weight loss. And physical signs of anorexia nervosa can include fatigue, dizziness, fainting, low energy levels, hair loss, dry skin, brittle nails, and irregular or absent menstrual periods in females. Mood swings, irritability, depression, anxiety, and perfectionistic tendencies. People with anorexia nervosa may also exhibit increased sensitivity to cold temperatures and may develop lanugo, or fine downy hair on the body as a result of malnutrition. It's important to note that not all individuals with anorexia nervosa will exhibit the same signs and symptoms, and the severity of symptoms can vary. If you suspect that you or someone you know may be struggling with anorexia nervosa or an eating disorder, it's crucial that they seek professional help from healthcare providers, therapists, or eating disorder specialists. Again, early intervention and appropriate treatment can greatly improve the chances of recovery. Individuals with bulimia nervosa engage in episodes of binge eating, followed by compensatory behaviors such as self-induced vomiting, excessive exercise, or the use of laxatives or diuretics. This cycle of binging and purging can have serious physical and psychological consequences. Binge eating disorder involves recurrent episodes of eating large quantities of food in a short period of time, accompanied by a feeling of loss of control. Unlike bulimia nervosa, there are no regular compensatory behaviors. Binge eating disorder is associated with feelings of guilt, shame, and distress. OSFED, which is other specified feeding or eating disorders, includes a range of eating disorder behaviors that do not meet the full criteria for anorexia nervosa, bulimia nervosa, or binge eating disorder. This category captures individuals who exhibit disordered eating patterns and may experience significant distress or impairment. Here are some warning signs and signals that may indicate the presence of bulimia nervosa. Consuming large amounts of food within a discrete period of time, feeling a loss of control during the episode, and experiencing guilt, shame, or disgust afterwards. Engaging in self-induced vomiting or misuse of laxatives, diuretics, or enemas to compensate for the binge eating episodes and avoid weight gain. Engaging in intense or excessive exercise routines as a means to burn off calories and compensate for food consumed during binges. Following strict diets, severely limiting caloric intake, or avoiding certain food groups in an effort to control weight and compensate for binges. Frequently disappearing to the bathroom or other secluded areas after meals, possibly to engage in purging behaviors. Experiencing repeated weight fluctuations, as individuals with bulimia may go through cycles of restrictive eating followed by binge eating and purging. Having an intense focus on body weight, shape, and appearance, and feeling dissatisfied with one's body, even when others perceive them as being normal or healthy weight. Frequent exposure of the teeth to stomach acid from self-induced vomiting can cause erosion of tooth enamel, leading to tooth sensitivity, cavities, and other dental problems. Repeated vomiting can cause swelling and tenderness in the salivary glands, as particularly noticed in the cheeks and jawline. Individuals with bulimia may experience mood swings, depression, anxiety, and exhibit secretive or ritualistic behaviors around food. It's important to remember that these are warning signs and not definite proof of bulimia nervosa, as each person may present with a unique combination of symptoms. If you suspect that you know of someone who may be struggling, again, it's crucial that they seek professional help from healthcare providers. They can provide evaluation, diagnosis, and develop an appropriate treatment plan tailored to that individual's needs. Early intervention can improve the chances of recovery and overall well-being. Athlete triad is a syndrome commonly observed in physically active females, particularly those involved in sports that emphasize leanness, such as gymnastics, figure skating, and endurance running. It consists of three interrelated components of disordered eating, amenorrhea, which is the absence of menstrual periods, and osteoporosis, which is a reduced bone mineral density. Relative energy deficiency in sport, or RED-S, is a more comprehensive and inclusive concept that encompasses the previous understanding of the female athlete triad. RED-S recognizes that low energy availability, which occurs when the energy intake is insufficient to meet the energy needs of the body, can impact both male and female athletes across a wide range of sports. It acknowledges that the consequences of energy deficiency go beyond the three components of the female athlete triad and can affect various body systems and performance. RED-S includes the following key components: low energy availability, so insufficient caloric intake relative to the energy demands of the body due to inadequate nutrition or excessive energy expenditure from exercise or training. Similar to amenorrhea component of the female athlete triad, menstrual disturbances such as irregular or absent menstrual periods can occur in both female and male athletes as a result of low energy availability. Reduced bone mineral density and increased risk of stress fractures and osteoporosis due to compromised bone health resulting from low energy availability. Hormonal imbalances affecting various systems in the body, including the reproductive, cardiovascular, gastrointestinal, and immune systems. Disruptions in metabolic processes, including alterations in glucose metabolism, lipid metabolism, and protein synthesis. RED-S can have significant psychological effects, including mood disturbances, increased risk of disordered eating behaviors, and decreased cognitive function. It is important to recognize that RED-S can affect both male and female athletes, although the manifestation and specific consequences may differ. Athletes at all levels and in various sports can be as susceptible to RED-S if energy intake does not adequately meet the energy demands of training and performance. Early detection and appropriate management of RED-S are crucial to prevent long-term health consequences and optimize athletic performance. This typically involves a multidisciplinary approach, including input from healthcare professionals, sports medicine experts, nutritionists and dietitians, mental health professionals, to address the energy imbalance and its impact on various aspects of an athlete's health. Education, monitoring, and support are essential in promoting a balanced approach to training, nutrition, and overall well-being in athletes. Hypoglycemia refers to a condition characterized by abnormally low blood glucose or blood sugar levels. It is commonly associated with diabetes, but can also occur in individuals without diabetes. Hypoglycemia typically occurs when there is an imbalance between the amount of glucose in the bloodstream and the body's requirements for energy. Symptoms of hypoglycemia can vary depending on the severity and individual response, but commonly signs and symptoms include shakiness or tremors, sweating, palpitations, or increased heart rate. hunger or increased appetite, fatigue or weakness, irritability or mood changes, anxiety or nervousness, confusion or difficulty concentrating, headache, dizziness or lightheadedness, blurred vision, tingling or numbness in the lips, tongue, or extremities. In individuals with diabetes, hypoglycemia can occur as a result of excessive insulin or certain diabetes medications, delayed or skipped meals, increased physical activity without adjusting medication or food intake, or excessive alcohol consumption. It's important for individuals with diabetes to regularly monitor their blood sugar levels and be aware of the signs and symptoms of hypoglycemia. For individuals without diabetes, hypoglycemia can occur due to various reasons, including prolonged fasting, certain medications, medical conditions, hormone deficiencies, and excessive alcohol consumption. It is important to take immediate action to raise blood glucose if you know someone is experiencing symptoms of hypoglycemia. This can be done by consuming fast-acting sources of glucose, such as fruit juice, regular soda that's going to get into the bloodstream very quickly, glucose tablets or gels, or consuming foods containing carbohydrates. If the symptoms are severe or do not improve after consuming glucose, it's important to seek medical attention promptly. Managing hypoglycemia involves identifying and addressing the underlying cause and maintaining a balanced approach to nutrition, medication if applicable, and lifestyle choices. Regularly monitoring of blood sugar glucose levels, following a balanced meal plan, and working closely with healthcare providers can help prevent and manage hypoglycemia effectively. When responding to a client who is experiencing, again, it's important to act quickly to help raise the blood glucose levels. You want to be aware of the signs and symptoms of hypoglycemia, such as shakiness, sweating, confusion, and hunger. If they exhibit these symptoms and have a history of hypoglycemia, take it seriously. Again, provide the client with a source of fast-acting carbohydrates to help raise their blood glucose quickly. Fruit juice, regular soda, encourage them to consume it promptly. If they have a glucose meter, help them check their blood glucose levels to confirm hypoglycemia. That can provide valuable information for determining the appropriate course of action. And remind them that it's important to eat regularly and snacks to maintain stable blood glucose levels. Suggest that they incorporate a balance of carbohydrates, protein, and fat in their meals to help prevent future episodes of hypoglycemia. If they're taking medication or insulin, remind them of the importance of proper dosing and timing. Advise them to consult with their healthcare provider if they suspect their medication may need adjustment. Provide emotional support to the client and reassure them that hypoglycemia can be managed effectively. Encourage them to follow up with their healthcare provider to discuss symptoms and develop a plan for future episodes to prevent future episodes. If the client loses consciousness or is unable to swallow, it's essential to seek immediate medical attention by calling emergency services. And it's crucial to remember, as a personal trainer, you should not provide medical advice or make adjustments to their medication regimen. Encourage them to work with their healthcare provider, such as a doctor or registered dietitian, who can provide individualized guidance and support for managing their hypoglycemia effectively. Personal trainers play a valuable role in helping clients with obesity, hyperlipidemia, diabetes, and eating disorders achieve fitness and health goals through adherence to a healthy diet and well-designed exercise program. Personal trainers should strongly consider the value of working in conjunction with the client's physician and with a registered dietitian in order to ensure the client's complete success. And doing so, they can play a significant role in the client's healthcare team. And that is all that I have for you today. I look forward to talking with you again. Have a great day.